Hi everyone, my name is Evelyn Odhiambo and I work for Reproductive Health Network Kenya. We are a network of service health providers in Kenya, and specifically we focus on providing comprehensive reproductive health care services and information for women and girls in our community and specifically in Kenya. I know you're probably attending the Africa Gender Equality Conference 2021, which is virtual, so congratulations, for this is the first ever Gender Equality Conference that we are having, and it's important that we look at how gender influence or affects provision of sexual reproductive health information and services. Today I want to speak to us about COVID-19 series and how this affected adolescent girls' access to sexual reproductive health and rights, and specifically services in our community and in Kenya. So when the onset of COVID-19, we saw a huge surge or spike on teen pregnancy, and this is because most of the adolescent girls were locked in either with abusers, with lack of comprehensive sexuality education. There was the limit to accessing sexual reproductive health services like contraceptive or and condom, because most of the youth-friendly facilities had closed down and clinics were also closed down. So this led to a huge increase in teen pregnancy, and most often unintended and teen pregnancies always end into unsafe abortion. So we lose a lot of girls to unsafe abortion, and we also see many of them walking into healthcare facilities for post-abortion care with very severe complications. And these are things that can actually be prevented before it actually happens. So that is one thing. Two, there's an increase in HIV infections amongst young people. And this is because even when they're having sex among themselves, because we cannot deny the fact that sex amongst young people is happening, they do not have actual and accurate information on how to protect themselves either from HIV or from STIs. So this leads to a huge transition of the new HIV infection amongst the young people themselves, because care with very severe complications. And these are things that can actually be prevented before it actually happens. So that is one thing. Two, there's an increase in HIV infections amongst young people. And this is because even when they're having sex among themselves, because we cannot deny the fact that sex amongst young people is happening, they do not have actual and accurate information on how to protect themselves either from HIV or from STIs. So this leads to a huge transition of the new HIV infection amongst the young people themselves because of lack of knowledge. Apart from that, we had also seen gender-based violence increasing. There were multiple reported cases of GBV in our community, and I remember there's a time the Kenya Ministry of Health reported to have had 5,000 cases, which 65% of these cases involved young girls below the age of 18. So indeed, with the restriction put in place to curb COVID-19 in our country, there was a lot of sexual health issues, threats and risk that was happening amongst young girls and amongst women in our community. And we can say that the pandemic has actually taught us on how to manage and control our healthcare system, not only to respond to pandemics, but to ensure that reproductive healthcare is at the center. We can for sure, end unintended and teen pregnancies. We can for sure end unsafe abortion complications and deaths, and we can for sure actually fight gender-based violence within our community. It is time that we stand up. It's time that we speak against these evil vices in our community and ensure that young girls in our community are able to access accurate information, are able to access contraceptive when they need it in the facilities, and they can walk comfortably into a youth-friendly service or a youth-friendly center and be able to talk to a counselor. It is time, let's do it now. If you're at the conference, ensure your voice is heard. Talk to our policymakers, make them hear our voice, because our adolescent girls deserve better all over Africa. Thank you and enjoy the conference.